Hello, everyone. Thank you for tuning in to the seminar today. My name is John Groves. I'm a family medicine physician at Lake Charles Memorial at their Astor Street Clinic, Memorial Medical Group. Today we will talk about mental health and crisis, beginning the conversation. So why did I pick this topic to talk about? And here's some numbers. Just 20% of people in America will experience mental illness in a given year. And we'll talk about what mental illness and mental health are. About 20% of children have either had or will have some seriously debilitating mental illness. And about 1 in 25 Americans will live with a serious mental illness currently, such as schizophrenia, bipolar disorder, and major depression, severe major depression. So when we say mental health, what does that mean exactly? Does it pertain to your feelings or your emotions or certain chemicals in your brain, neurotransmitters? And mental health is actually when these things work together so that you can interact with your family and friends and your workplace. And so it's kind of all these things together is what we mean by mental health. So mental health can be affected by stress. And what exactly is stress? Well, it's anything that is an external a factor that's affecting your mind or your body. It's the way you respond to external factors. And so when you have a lot of stress, excess stress, it can affect your appetite, your energy. It can affect your the way you were interested in things. You might not be interested in doing things you used to do. And these kind of overlap with certain mental illnesses. And it can kind of lead into mental illness if you have too much stress and don't know how to cope with it very well. So what are some ways to deal with stress? One thing we could do today, we're kind of always exposed to the news. It's on our smartphones and in our social media apps. And so one thing you could do is kind of just schedule some time to disconnect from those things. Take some time to relax and unwind. Find people in your community you can talk with, or in your church, or other faith-based organization. So seeking help. When should you go get help for problems with stress? When might you start to be developing a mental illness? And so if you feel like you are having thoughts about hurting yourself or thoughts about hurting other people, or if you're just having a hard time with meeting your demands at work or at home, or just not interacting well with other people, that might mean it's time to go get some help. So what exactly is a mental illness? Mental illness can be major depressive disorder. There are multiple anxiety disorders, bipolar disorder, which involves depression and just feelings of sort of hyperarousal, being on edge, and post-traumatic stress disorder is also feelings of hyperarousal, and this is what we'll talk a lot about today: post-traumatic stress disorder. So these are examples of mental illness, and mental illnesses are diagnosed with this picture I have here: Diagnostic and Statistical Manual of Mental Disorders. This is made by the American Psychiatric Association and frequently updated, and that's how we diagnose mental illnesses in the United States. So I put this slide in to kind of highlight the unique circumstances of people like Charles. We've had 2 very large hurricanes, pandemic with this coronavirus, and a lot of just bad weather events. We had a big freeze in February, and then there was a election year last year. So lots of stress in this area, and we'll talk about how natural disasters can kind of lead into post-traumatic stress disorder, or can make you more likely to get post-traumatic stress disorder. And so I put this slide in to say that this is a well-studied thing. There are lots of people who are affected very severely by natural disasters, hurricanes, earthquakes, and the forest fires in Oregon and Washington and those areas. And so it can be a little bit difficult to diagnose people with PTSD after a disaster. That's the abbreviation for post-traumatic stress disorder, PTSD. And so that can be difficult to diagnose because people are more spread out, and it's hard to find everybody who was affected, and it just is kind of difficult to pick up on. But it does exist. And so this is a site from the United Kingdom, and they just noted on this website that the suicide rate in Puerto Rico after Hurricane Maria was 25 per month in the 3 months after Hurricane Maria, and then it was 18 per month in the 3 months before Hurricane Maria. So just an example of how a natural disaster can change the levels of mental illness. This slide I put in just to remind me to tell you that children can also develop post-traumatic stress disorder. It's a little bit more difficult to diagnose, and this study looked at 3 different criteria for diagnosing it, and they couldn't really agree on which set of criteria were best to do that. And this slide just summarizes what the findings of that study was. So we'll talk about how is post-traumatic stress disorder diagnosed, and these are the criteria from that book I shared with you earlier, the DSM-5, the Diagnostic Statistic Manual for Psychiatric or for Mental Illness. And so the criteria to diagnose post-traumatic stress disorder, there are 4 different big groups of criteria, and they're A, B, C, and D. And so the A criteria is anybody exposed to threatened death, serious injury, or sexual violence. And this could be like first responders or police officers who have to deal with constant traumatic events and are exposed to the consequences of those events. This could be somebody who had a very severe car wreck and had to get an emergency surgery. This could be somebody who was in their house when Hurricane Laura came through and it tore off the roof of their house. This could be somebody who had experienced rape on a college campus or some party. And so these are ways that people could develop post-traumatic stress disorder and this is the first criteria in the diagnosis. So the second big group of criteria is presence of intrusive symptoms, and so the intrusive symptoms are like what's called flashbacks, and that's sort of when some external stimulus causes you to have a flood of memories of the traumatic event. So that's criteria B. Criteria C is when you avoid situations where you might have exposure to those stimuli, and that could be someone who may have suddenly lost a family member at a festival. Maybe they were at a festival with their uncle or their parents, and somebody suddenly died from a massive heart attack. Then they might not ever want to go back to a certain festival or that situation. So this is what's meant by like persistent avoidance of the stimuli. Criteria D, that's when your mood changes and people around you notice that you're not the same person you were. You may have been a very outgoing person before the traumatic event, but afterwards not so much. So that's what's meant by that criteria. And I also should tell you that in children this could be different. So in children, if they don't have so much flashback symptoms, but could have, they could be acting out the traumatic event in their play, and so that's how it looks a little bit different in children. So when you go see your doctor, and if your doctor is concerned you have post-traumatic stress disorder, what they will do, they might show you something like this. I don't want to really go through all this with you. I just want you to see that there are these checklists out there that can help diagnose post-traumatic stress disorder, and the higher the score, the more likely you are to have post-traumatic stress disorder. So this article I put in just to say that you don't have to be directly affected by a natural disaster to develop some form of a stress disorder. And this article looked at something called vicarious trauma. Vicarious just means you didn't directly experience it, but someone you know, or and some maybe your family or friends did experience a disaster. So this study looked at people from Haiti living in the southeast United States who had family members directly affected by the earthquakes in Haiti in 2010, I think. And so this study looked at people who had family or friends that had some trouble, that had some trouble, lost their house, or didn't have enough food or water, and the family members in the southeast United States, they were not they were more likely to have a post-traumatic stress disorder. So from there we'll move on to the pandemic and mental health, and talk about how people's levels of depression and anxiety have gone up. But before we talk about that, I'd just like to say that even if you were not affected directly by one of the hurricanes in this area, but maybe having some difficulty with having the best mental health you could have, then please go try to get an appointment with your doctor and talk to somebody about that. So now we'll talk about like pandemic and mental health. And the pandemic caused a lot of things to happen. One of the things was lockdowns. So a lot of people had to stay at home, where their routines were greatly disrupted, and a lot of people developed more depressive symptoms. And this study looked at the rates of depression or depressive symptoms before and after COVID, or before and during COVID. And before COVID, you can see that the percent of people who had no depressive symptoms went down. The dark blue bar is before COVID, and the light one is during COVID. And then the percent of people who had some form of symptoms went up in all the groupings: moderate, moderately severe, and severe. This says the same thing, but this is just with the numbers. You can see the higher numbers in the last 4 rows here. So what exactly is depression? So major depressive disorder is a mental illness. There are symptoms that anybody, even if you don't have major depressive disorder, you may have some of these symptoms, and they include low mood, changes in appetite, sleep disturbance. And now it's recommended, if you go see your doctor for anything, if you're not having symptoms, the United States Preventive Service Task Force recommends that you get screened for depression. And that could be as simple as your doctor asking you, have you had a low mood in the last 2 weeks, or have you lost interest in doing things you like to do in the last 2 weeks? So this is the questionnaire I wanted to share with you. I don't really want to go through this either in detail, but just to say that there is a questionnaire that a lot of clinicians and advanced practitioners use, and this can help diagnose the major depressive disorder. There are there are 9 questions here. And the higher the score, the more likely you are to have depression. So severe depression is when you have a score of greater than or equal to 20 on the form we just looked at. And severe depression could also include suicidal ideation and behavior. It could include psychotic or catatonic features. So psychotic means that you're seeing things that other people can't see, or hearing things that other people can't hear. And catatonic is just when you are just you feel like you can't move, but you previously were fine and could move, and so those features may be present in severe depression. Severe depression may require hospitalization, but it definitely does require treatment. So if you're having depressive symptoms, please seek out help with your doctor or your counselor. So suicide is the worst manifestation of severe depression, and this has gone up in the United States about 33% in the last 20 years. It's the 10th leading cause of death in the United States, and it's different leading causes for different age groups, and you can see those there. So the groups at higher risk for suicide with major depressive disorder are veterans. Veterans are much more likely to attempt and complete suicide than other groups. Non-Hispanic, white people, and American Indian, Alaska Native peoples about 2 times more likely to complete suicide. People who live in rural areas are also more likely to more higher risk for suicide. People who are involved in mining and construction, and then young people who are lesbian, gay, or bisexual also have higher rates of suicidal ideation and behavior. So suicide also affects family members and friends, and there's a phenomenon called suicide clusters, in that people who may have had, or people who have lost a family member or friend to suicide may try to copy that person or also attempt suicide. This also affects the community, and it's also a significant impact on the healthcare as a whole. It's about $70 billion on lifetime medical and work cost. So suicidal ideation is when a person has thoughts about suicide. Maybe they don't have a concrete plan, but they are kind of thinking about it. And so the World Health Organization did a study in 21 different countries and found that within a year, about 2% of people that they surveyed had some thoughts about suicide. And then in those people's lifetime they had about 9% rate of just thinking about suicide. So people who do have suicidal ideation may go on to complete suicide within the first year of having thoughts about suicide. It's about 60% chance that could happen. More than 50% of people who have suicidal thoughts don't get mental health services. So suicide prevention, it is something that can be prevented, and here are some resources. There's a number here and a website, and this just kind of shows how prevalent suicide is and suicidal ideation. So if you are having any thoughts about suicide or know someone who is having problems with this, here are some more resources, and I would just urge you to talk to somebody. If you know somebody who you think may be having thoughts about suicide, I would say just simply ask the person, are they having thoughts about killing themselves? Do they have a plan for doing that? And that might be an opportunity for that person to open up to you and kind of talk about what's going on with them. Anxiety, there are multiple anxiety disorders, and we'll just briefly look at that. And so this is a study I put in to tell you that the levels of anxiety have gone up after the COVID-19 pandemic. And this study was in Canada and looked at moms who they were surveyed before the pandemic, and then their levels of anxiety were measured, and the same group of mothers were surveyed after the pandemic, and they just had higher levels of anxiety. So generalized anxiety disorder has a bunch of different symptoms that kind of look like depressive symptoms, but not exactly the same. There's a lot of worry about just day-to-day things, and the person is not able to control that worry, and they may be more irritable and have difficulty sleeping. So this is another scoring form that can be used with anxiety, and this one may not be the one that your doctor uses, but this one is a well-known one, and the higher the score, the more likely you are to have anxiety. The panic attack is something I would like to talk about, just because that this shows that mental illnesses can have physical manifestations. In the panic attack, people may feel like they're having a heart attack, or may feel their heart beating very fast. And I would say if you're having some problem that you think might be your heart, please go get that evaluated. So panic attack can also involve trembling or shaking, sweating, just breathing very fast. So a very severe manifestation of anxiety. So moving on from there, I would just like to talk about, how has the pandemic affected children, and what can you do to talk with your child about keeping their mental health as good as it can be during this time. And so the pandemic has sort of changed everybody's routine, but children probably more so. Their schools were closed, they had to go to virtual classes, and and children also, their children may have been relying on schools to give them breakfast and lunch, and now don't have that sort of food safety net, and so there's problems with that. Also, with the closure of schools, there were more children who may have been experiencing abuse in their homes, and teachers and schools were well known to be some of the #1 reporters of this kind of thing. And so children have been probably one of the most adversely impacted groups of people by the pandemic and lockdowns and all those things. So some behavior changes you might notice in your child are just like a lot of crying, a lot of irritation. They may not be doing as well as they used to do in school. They may start using drugs or alcohol, whereas before they had never expressed any interest in that. And if you have a teenager at home, they might be having some acting out behaviors. So what are some ways you can support your child? So some things you can do are to try to get a routine if the routine has been disrupted. And that could look like maybe just instead of commuting to school or to daycare, you just go down, walk to the mailbox with your child and back. And it may be something as simple as just scheduling some reading time every day with your child, or some time where you play a board game with your child. And another big thing you can do is to limit your children's exposure to the news and to social media, because children sometimes have a hard time interpreting the things that they see there. And you should also, if you're concerned your child may be developing a mental illness, please talk with their doctor about that also. So moving on from there, we'll talk about treatment options just briefly, and we'll go through some of those. So cognitive behavioral therapy, what is that? So that's when you work with a counselor or somebody trained in cognitive behavioral therapy. A lot of counselors are trained in cognitive behavioral therapy, and so you work with this person, and they help you examine the thoughts and emotions behind the way you respond, the way you do to certain stresses. There are people who are trained in cognitive behavioral therapy for insomnia, cognitive behavioral therapy for trauma. So this is a big treatment. It's well known, and it's a safe and effective treatment for a lot of mental illnesses. Counseling, you could talk with your counselor about the symptoms you have, and counselors are trained in different ways to talk with you and help you think about the way you're handling the stressors. And you don't have to have a mental illness to talk with a counselor. A counselor can help you have the best mental health that you can have, sort of like the way a personal trainer can help you with your physical health. Medications are available for mental illnesses. There are a lot of safe medications, and there are multiple medications for multiple mental illnesses. And so your doctor may suggest or recommend you start a medication. And if you try one and it doesn't work for you, please talk with your doctor about that, because there are multiple different medications for mental illnesses. So exercise is also a good way to deal with mental illness and to help you have a better mental health. This has been studied and shown to be effective with multiple mental illnesses. I would recommend that you don't try to go from no exercise to too much exercise, because you could get a physical ailment that could keep you from exercising. So group talking, like community talking, and just sharing your symptoms and with other people who may have the same problem or same mental illness. This can be sort of a liberating thing, just to know there are other people who have the similar problems, and you can talk with them about how they handle that. So inpatient treatment, this may be something that's needed for severe forms of mental illness, or certain severe forms of bipolar depression, people who either have attempted or think they may attempt suicide, people who may have something called schizophrenia, which is a splitting of the personality, and these people may have psychotic features, and so these people would need inpatient treatment, and that's available too. So I think that sort of ends the talk. There's some resources here that are available to you, and we'll put those in the show notes. But in closing, I would just like to say that there's help out there. If you think you may be suffering from a mental illness, please don't hesitate to seek help, to call your doctor, or reach out to a family member or friend, and get help out, get some help for yourself. Okay. I think that any questions, you can post those in the comments section, and we'll go over those.
Yeah, so we got a couple of questions. How can I tell if someone has a mental health problem?
So one of the things that may key you into that is just a change in their behavior, and so they're not the same person that you knew before. And that might mean somebody might be developing a mental illness.
Could the use of antidepressants be habit forming?
And the antidepressants are very safe, and it's not something that you'll get addicted to. You might find that your mood is a lot better on them, and it is recommended for you to try to come off of them after you've gone through major depressive disorder. And you feel like you're getting better. You should talk with your doctor about trying to wean off of it. It's not something you'll need to take the rest of your life, but you may find that you feel better and may not want to come off of them too soon.
And another question, can depression be hereditary? For example, if a parent had severe depression, will a child more likely be to develop depression?
So depression is it's kind of a big question, if it's hereditary or not. It may be affected. It might be because of the environment, and some children are raised in similar environments that their parents had been in, and so that might make a child more likely to develop depression. But and there's some evidence that can be genetic. Some people with bipolar depression have been shown that their family members are more likely to get bipolar. So that's a big question, and I guess the answer would be that it can be caused by the environment and may or may not be caused by genes.